Everyone admitted to hospice has to have a terminal diagnosis, and we are reviewing those specific criteria that allow Medicare to admit a patient to ongoing hospice care. We are going to talk specifically today about those requirements for dementia and Alzheimer's. I'd like to make one point today, an important note. Criteria that I'm going to be reviewing is current Medicare criteria. However, for the first time in 20 years, these criteria are now being reviewed and the changes will be disseminated soon. So as of today, we're talking about dementia and Alzheimer's. And one more quick comment. Remember that Alzheimer's falls under the overall umbrella of dementia. This diagnosis can be very difficult to tie down, and Medicare is very careful when looking at the documentation by all disciplines. So it's really important to document specifically and clearly to avoid denial by Medicare. So let's move on to the criteria. The patient should have a FAST score of 7C or higher. Speech is limited to 6 words in 24 hours, or 1 word can be repeated constantly. They're having trouble making their needs known. They can't even respond to the simplest commands, such as squeeze my hand. They aren't able to express feelings or answer questions presented with understandable dialogue, and the speech may also be slurred or garbled. The patient may be quite agitated, unable to define their discomfort. They can be resistant to care, pushing a caregiver away, and even become violent. They may have pain without being able to identify it. They are unable to ambulate without assistance. They need assisted devices. They can't lift their feet fully but drag or shuffle. They may be impulsive with frequent falls. Now on to the secondary complications. The patient may have aspiration pneumonia, frequent urinary tract infections, URIs, stage 3 or 4 wounds, a recurrent fever, a weight loss of 10%. There may also be comorbid conditions distinct from dementia, and that could be CHF, COPD, hypertension, AFib. Each has impact on their functional impairment. We highly recommend using the frailty scale to evaluate the patient as a clear and objective support tool for admission. It looks at numerous factors in the overall function of the patient and gives them a numerical score. Please watch our series on the frailty scale. Get familiar with it. Carry a copy of the scale with you. Gather all the information. And during the admission evaluation, you will have a lot of information in talking with a medical professional about the actual admission. Remember, admission is not black or white. Become familiar with the criteria for each of the major diagnoses. Be the detective, be observant, listen closely, and be the advocate for the patient. Please continue to watch all of our videos every day and our new blog at the Hospice Care Plan. Our motto, the care is treatment, and you're the one providing the care.